Assalamu alaikum wa rahmatullah wa barakatuh. Hello, dear fellows. I'm happy to begin with you the new module Critical Thinking in the ML Web. In the first week of the Critical Thinking, by the end of the first week, we can define the critical thinking concept, explain the importance of critical thinking, outline critical thinking skills, and the different strategies used to promote critical thinking. At first, we need to define the concept of critical thinking, which is defined as the ability to identify, analyze problem, as well as seek and evaluate the relevant information in order to reach an appropriate conclusion. Tanner also explained the clinical judgment as interpretation or conclusion about patient's needs, concerns, or health problem to take a decision or using or modifying standard approaches to improve them and to reach appropriate response of the patients. So we can define or outline the importance of the critical thinking, as the doctors expected to take the effective decision in well-defined and ill-defined emergencies. Higher order thinking has become one of the essential features for tomorrow's doctors to maintain their clinical competency and medical professionalism. So the critical thinking should be fostered at grassroots level among the medical students, which will promote better decision-making when they eventually practice. So we can conclude that the importance of the critical thinking for both students and the professions, as it helps them to become more confident, help to climb their leadership ladder, get high grades by better knowledge they obtained, understand the subjects better, succeeds in their careers, so they become long life learner. For the professionals, they avoid their medical or clinical errors, identify better alternate options for diagnosis and treatment, and better decision with limited resources and time, make their thinking in a higher quality so they can bring innovating methods in treatment. Harrison and his colleagues mentioned that the critical thinking consisted mainly of three components. These three components concluded in process, which is actively and skillfully conceptualize, applies, analysis, senses, or even evaluate information and knowledge. The method used in this is observing, experiencing, reflecting, reasoning, or communicating in order to knowledge acquisition, which is the purpose of this process. What's the skills needed for critical thinking, or how we can be a critical thinker? At first, we have to have open-mindedness, to be creator, to communicate well with others and with the circumstances, to make for all of them analysis so we can reach the problem solving. How we can promote our students to be critical thinker, how we can updating their skills and use their skills to be a critical thinking. The first of all is the PBL, problem-based learning, as it provides opportunities for the students to relate their knowledge with prior understanding. The second is role modeling, as it facilitates student learning and help them to develop their professional identity by observing their clinical tutors. The second powerful tool is the reflective writing. They can reflect privately. The students can reflect privately, open their previous steps or their mistakes, and they can modify by analysis them. The other many methods is 1 minute paper, team-based learning, using concept mapping, and think, pair, share. All of these strategies can promote critical thinking in our students. So we can summarize. We define the concept of critical thinking, known its importance, skills, and components, and finally, we reach to some strategies we can use to promote critical thinking. Thank you.